Good evening, everyone. We'll go ahead and get started. My name is Sonny Brown, and I am a co-convener of the Bishop's Task Force on Gun Violence for the Episcopal Diocese of North Carolina. I live in Roanoke Rapids and am rector of All Saints Episcopal Church in Roanoke Rapids. My co-convener for this work is Sarah Smith, who is a lay leader at Church of the Holy Family in Chapel Hill and works with North Carolinians against gun violence. Our Zoom host this evening is Christine McTaggart, who is Director of Communications for our diocese. And we are joined by three panelists that I would like to introduce, who will be speaking with us about what are CVIs, or Community Violence Intervention Programs, and how they operate, where they are operating now in our state, and what they can do to reduce violence, particularly gun violence, across the state of North Carolina. And we are joined by, in no particular order, Dr. David Jacobs, who is a trauma and acute care surgeon and has seen firsthand the experience at the end of his own hands in the operating room, the effects of gun violence in the Charlotte-Mecklenburg area. He works with Atrium Health, Carolina's medical center in Charlotte, and works with the Community Violence Intervention Program there. We are also joined by Tracie Campbell, who is the Senior Health Manager for the Office of Violence Prevention with Mecklenburg County Public Health. She is responsible for promoting public health strategies to reduce gun violence throughout Mecklenburg County. And last, we are joined by Gerard Tate, who has recently begun work to lead the state's Office of Violence Prevention. He will serve as the first director of this office, which was just established by Governor Cooper in March to help reduce state gun violence and firearm misuse. So those are our three panelists that will be discussing with us gun violence, but more specifically, community violence intervention programs and how these can help prevent it and prevent violence in general. So with that, I will turn it over to our panelists to begin. I believe we're going to begin with Gerard. Welcome.
Thank you very much, and good evening to everyone. Very happy to be here. Community violence intervention is the topic. I am the new-ish, I guess now it's actually 3 months today. So this is a good kind of anniversary speaking engagement. I came to this work different than most people who come to CVI work. I spent the first 10 years of my life as a law enforcement officer in the military, where the last 7 years as a criminal investigator focused on domestic violence and child crimes, which is where I first kind of ran across the field of social work and the importance that it had in particularly treating victims and addressing trauma. Someone convinced me that I should probably go to school to get a master's degree in social work and then later a doctorate degree in social work to work on these issues. So those are kind of the lenses that I bring. But I think before all of that, I was born and raised on the south side of Chicago in the Englewood neighborhood, where gun violence was and unfortunately still is the norm. And where I first had interactions with CVI programs, which is kind of maybe the most well-known one in Chicago in 2000, which we'll get to. So CVI in general refers to strategies and programs aimed at preventing and reducing violence in communities by often addressing the root causes of violence and some of the social, economic, health factors that play into it. They're typically done with people from the community, which I think is a bit different than the traditional law enforcement approaches. It's from people from the community and those closely associated with it, including health partners, public health partners, education partners, and yes, clergy. Some of the three most kind of well-known forms of CVI is street outreach, which we'll speak about, hospital-based violence intervention programs, and then there's some trauma outreach programs that are new and kind of emerging. New York has kind of the largest one that doesn't technically do violence prevention intervention work. They more go out to do a lot of the healing, identification on where a lot of violence and victimization has been happening, and they bring some holistic healing around to it. There is one other that is kind of a mix of both, called group violence intervention, which some people may hear or have heard about, and that actually brings in law enforcement and community leaders and clergy as a huge part of it. And if anybody heard of the Boston Miracle, Operation Ceasefire back in the day in Boston, it was co-led by police and clergy, which is another kind of early form in the 90s, even predating a lot of the outreach programs in Chicago. So those are kind of the three main ones. It's still it's existed since early 2000 in some forms before then, for sure, because communities have always kind of came together to try to address ills that have been happening in the community, to start off social work with settlement houses, things that clergy and church have been doing for a long time, and working particularly with women and children who had domestic issues, homelessness issues, who may have found themselves on the wrong side of the law, or just trying to survive, and unfortunately doing that through some illegal and sometimes violent means. So I'll stop there and explain just an overview of CVI. I don't know if we want to ask any questions right now, if we want to move on a little bit more. I forgot one thing that's probably most important. In my role as the executive director of the Office of Violence Prevention at the state level, we're tasked with supporting city and county efforts, as well as bringing a whole of government approach to support programs like you will hear about later today. And so that's both from a policy standpoint, from a funding and strategy standpoint, technical assistance and advising, where people working at the city and county level have to work on that every single day. We get to sit at kind of 30,000-foot view and look at trends, analyze best practices, see who across the nation could support our efforts, whether that's financially, with expertise, with other resources, and really learn what are some of those emerging evidence-based practices that we can bring to our cities and counties to assist them in the work that they do. Another thing is, how do we help them collaborate, right? What is Wilmington doing? What is Charlotte Mecklenburg doing? What is Raleigh? What is, and so how do we look across that and bring them together to create learning communities? And last, we have amazing universities. And so how do we bring together those universities and the best minds from medicine, from public health, from social work, from psychology, to ensure that our training and technical assistance is being delivered with the most relevant and best available evidence that's around. So.
All right, I think you teed that up pretty well for us to just segue into my conversation. Good evening, I'm Tracie Campbell again, and I actually run the Office of Violence Prevention for Mecklenburg County from the Public Health Office. And so our office was started about, it'll be 3 years next month. And so we are still relatively new, and for a long time, we were an office of one. So I'll start by shameless plug to say that, yes, we do need more funding in this space so that one person doesn't run an office, because that's ridiculous. But we made it through. And so I'll tell you that really the impetus for getting started with this office was out of public outcry. We had people that were just like you in Mecklenburg County that were looking at local government officials and saying, what are you doing? This is ridiculous. It's completely out of hand. And we're grateful and lucky that we have a health director who came from Philadelphia, had done some work with their Office of Violence Prevention in Philadelphia, and brought this idea that maybe we need to have an Office of Violence Prevention. And so this is how this office was born. One thing that I'll say as I'm going through this, you'll hear a lot about, and Gerard already talked about this, some about collaboration. This work cannot occur in a vacuum. We can't hold law enforcement responsible. We can't say the schools aren't doing enough, that parents aren't doing enough, that clergy and faith leaders aren't doing enough. It takes everyone. And so one of the things that we were charged with initially was developing a strategic plan. And so our strategic plan in Mecklenburg County is called the Way Forward. And it's called the Way Forward because we do believe that the way forward is together. And so again, we cannot do this in a vacuum. Violence doesn't occur in a vacuum, and we certainly can't reduce it in a vacuum as well. And so one of the strategies within this plan is to support and expand our CVI programs, and so as well as our hospital-based programs. And so I talked to you a little bit about a whole lot of the things that we're doing. All of the things work in conjunction. So CVI is a great way to help reduce violence, but it is a slither in a big pie. There takes a lot of things that have to happen, and they have to happen in conjunction, in tandem with one another, or it just is not effective. So we really value our putting community voice at the forefront of all the work we're doing. And so CVI does that. It puts community in the forefront, us providing what community has asked us for, not for what we think community needs. And so one of the things that we have done in Mecklenburg County is we're going into year 3, really. In one of our aspects is that we have our Alternatives to Violence. So our ATV program, this is our CVI program in Mecklenburg County. And so when we started this program, again, there was not another program in the state that was really operating under at least some type of government entity, right? So there were people doing this work, and I think I'll be remiss to say that when you get involved in this work or you want to support this work, that you really need to start with doing kind of a landscape analysis, finding out who's already working in this space. The last thing you want to do is to start promoting, oh, let's do this, and you find out there are people that have been doing it 20 years. That's a really good way to not have community buy-in and them to support what you're doing, because now they're mad because you didn't acknowledge that they have been out here in these streets for 20 years doing this work. And so we really try to involve those organizations and people that are doing this work into this CVI work. So when we started our Alternatives to Violence program, we started a pilot program in one area where we were seeing a large number of violent acts occurring. And so that's in our Beatties Ford LaSalle corridor. And we used data from local law enforcement to help us determine that this was a great spot for us to start this program. It was an investment that was a joint investment from the city of Charlotte and Mecklenburg County. We both put in $250,000 to start this pilot program. One of the great things about CVI programs is that they utilize people in the community that are from the neighborhoods in which they're planning to serve. And so, you know, some takeaways are, you got to find the right people. That is key to get this work done. They have to know the community, have to be seen as trusted in the community. It doesn't matter. Some of them are going to have some, what you look at and might say are some unsavory behaviors that they've engaged in the past, and that's okay, because that actually makes them more credible in the neighborhoods with the high-risk individuals that they're going to be serving and being involved in. So we had a lot of growing pains. Sometimes you build a team and you think they're great, and then they don't work out. And that happened to us. It all fell apart. We lost a whole entire team, and we had to start all over from scratch. And so I'll say that as you get involved in this work and supporting this work, don't be discouraged when things don't go the way that you intend for them to go. You want to move the needle slightly, and sometimes it just seems like you're not going anywhere, but every bit of effort that you're putting forth is going to pay off in some way, form, or fashion. So again, this program's been operating now for 2 years at this site. We're into what would be year 3. We kind of count it as year 2 because the first year was kind of a flop. Again, we lost that whole team and had to start back all the way over. So one of the things that we have been able to do is been able to expand our CVI site. So our Alternatives to Violence program is expanding from that Beatties Ford LaSalle corridor to 2 additional corridors. So in the first year, we were able to receive some additional funding. So we got $1 million from Wells Fargo and $200,000 from Greenlight Fund to help support this program as we were going forward. So now we have been able to secure $2 million worth of funding from Congresswoman Alma Adams' office through a congressional earmark to help us support the expansion of that program. So we've looked at the data, we've identified 2 additional areas in which we're going to move the program to, and those sites will be up and running this month. They'll be going to finish their training and be out doing work. So we're excited about that. One of the things I'll say that we're were able to gather from our data and our research, we partnered with UNC Charlotte to help us evaluate this program. And one of the things that they were able to tell us with the finding is that there was a statistical significance, a lower rate of homicides that occurred in the Beatties-Ford area where we had our alternatives to violence program operating. And that's in comparison to similar neighborhoods. So we're really proud about that. And I'll say, as I kind of close out and give the reins to Dr. Jacobs here, is that everything is not based on the numbers. There are people, and they're going to be stakeholders that want to see the numbers. They want to count beans and how many people have you seen this? Sometimes that's not what really matters. Yes, we certainly want to see the numbers go down, but we really want to see the impact that these programs have in community and how they are impacting the lives of people that they're serving. One of the things I think we're really proud of is that in this CVI program is that participants are able to work with staff to set goals that they have for themselves. The majority of our participants are between ages of 14 and 24. Majority of them, their goal sets were centered around education. And so the majority of those folks were able to actually meet their educational goals that they set for themselves. And so whether that was going back to school, getting a GED, just actually going to school every day. So it's nice to have someone that would check on you and say, you didn't go to school today, or come by your house and see why you're not there. So we're proud of that and proud of the work that they are continuing to do in that area. So I'll stop there because I can go on for days with a lot of other things. I'm sure I'll come back with some more, but I'll turn it over to Dr. Jacobs.
Good evening, everyone, and thanks for being here. I'm learning as much as the rest of you are as we're sitting here talking about this. It's interesting. Mr. Tate is now in his third month. Ms. Campbell is now in her third year, and I'm close to my 30th year doing this. So I'm the spring chicken on the block here. And so, as you've heard, I am a trauma surgeon, and a trauma surgeon that, quite frankly, just got fed up of seeing person after person after person coming in with gunshot wounds. As I mentioned, I've been doing this for 30 years. We've made some progress, and then over recent years, things seem to have slipped a little bit. And so I'll describe sort of what I do, my interest in this, and then talk a little bit about hospital-based violence intervention. I would first start off by telling you that as someone who works in healthcare, I think, and I'd be interested in my co-panelists' thoughts on this, I think it's important to view violence as a disease. We spend millions and millions of dollars on heart disease and stroke and cancer, and all that is important. But violence is the #1 killer of young people in this country today. We just recently overtook motor vehicle crashes as the #1 cause of youth death in this country, and yet we spend very, very little money looking into the causes of violence. So I think when we have discussions about violence, it quickly can become very political, because you're talking about things that can be very polarizing. You're talking about race, you're talking about gender, you're talking about guns, you're talking about politics. And quite quickly, if you're not careful, folks can retreat to their own respective corners. And we need everybody. I think you heard both Ms. Campbell and Dr. Tate talk about the fact that we need everybody in this fight. This is not something that we can arrest ourselves out of. Law enforcement plays an important role, but everybody has got a role in this. And so if you look at violence as a disease, we know that it occurs in specific communities, in specific individuals, in specific communities. We know that it can be passed on from person to person and generation to generation. And probably most importantly, we know that there are things that work. And so I think there's every reason for us to be thinking about this as a public health problem, like cancer, like smoking, like car accidents, and put the money and the resources behind it that will hopefully help us achieve the successes that we've achieved look what we've done with smoking. Look what we've done with car accidents as causes of death in this country. We've made great strides because we all recognize that these were things that were preventable and that we could put our efforts and our time and our treasure, if you will, behind those efforts. And so, from a career perspective, I've been taking care of trauma patients for years and years and years. And we've struggled trying to figure out what the causes of violence are. And people will say, well, it's gangs. People will say, well, it's drugs. People will say, well, it's the media. And there's a lot of finger pointing that can occur. But I think what we've realized most recently now is that, again, looking at this through a public health lens, there are things that we call social determinants of health. And we know that violence occurs in specific communities and is associated with things like poverty and racism and poor schools and food deserts and housing insecurity, all the things that historically the church has been working to eradicate. And those are the things that we really need to be focusing on. And so let me pivot and talk a little bit about hospital-based violence intervention, which is one of those community violence intervention strategies that we are trying to employ. Community or hospital-based violence intervention has been around for at least 25 or 30 years now. Although Atrium here in Charlotte is the first hospital-based violence intervention program in the state of North Carolina. So I would say that North Carolina is a little bit behind the eight ball. I would tell you that the Southeast is probably a little bit more behind the eight ball than some of the other areas of the country, specifically California, which again has been doing this for probably 25 or 30 years. Hospital-based violence intervention is based upon a very simple principle, which is that perhaps when you are injured badly enough by violence to wind up in a hospital, that it may be the opportunity for you to step away from your current circumstances, whether that's neighborhood, whether that's relationship, to step away from that for a second and consider the circumstances that led to your being violently injured, and perhaps thinking about making changes that will make you less likely to be a victim or perpetrator of violence moving forward. And so we think about this as a teachable moment, that here we have a patient that comes into the hospital as a result of violence. He or she is now rethinking, maybe I should choose a different pathway. And we at the hospital have to be ready to assist those patients in those life-changing decisions. And so I just mentioned earlier some of the things that we know are associated with violence, whether it's food insecurity, whether it's housing insecurity, lack of education, poverty. Those are the real root causes of violence. And so we have to, as a hospital, we believe that we have to be able to address those issues. If we don't address those issues when the patient is in the hospital in front of us, then it's been quoted, there's a 25 to 40% chance that they will become victims or perpetrators of violence again in the future. And so how does this work on a day-to-day basis? Every hospital program is a little bit different based upon the resources that they have. But if a patient comes into the emergency department and they're shot or stabbed, we have someone that is available either in person or on call who can come in and make an immediate connection with that patient, understand why that patient became a victim of violence, what were the circumstances, were drugs involved, was alcohol involved, was domestic violence involved, and two upfront questions. What is the likelihood that there's going to be some retaliation related to this incident? So if someone is stabbed, is someone out there right now looking for that person that did the stabbing? That's where we work with our street-based violence interrupters who can understand the circumstances that led to that stabbing or shooting, and hopefully prevent retaliation. And then our other goal is to perform a thorough assessment of that patient's acute social needs, and develop a prescription for them that again will hopefully make them more resilient to violence in the future. And that could be finding them a job. Sometimes things as simple as tattoo removal so that they can get out of a gang, or housing assistance, job assistance. A lot of our patients we find are needing mental health services. These are folks who live in neighborhoods that experience what we call chronic trauma. They hear sirens all the time. They hear gunshot wounds all the time. They may or may not see episodes of violence in their homes, on the school buses, on the way to school. And so they have chronic trauma and what we call a sort of a chronic hypervigilant state. And again, unless we address those issues, we're going to see those patients again. So we develop that prescription alongside the patient, and then we follow that patient for 6 months to a year to be sure that they have been connected with those services, they're following up with those services, those agencies are providing the services that we've asked them to provide, and the patient is remaining violence-free. Our program is probably a year and a half old now. We launched in January of 2022. We've seen about close to 200 patients, and we have not had any patients who have subsequently become re-engaged in violence that we are aware of. I'll put that little proviso on there. But I think as Tracie said, re-engagement in violence should not be the only endpoint in terms of the success of these programs. Were we able to get a patient out of a gang? Were we able to get a patient a job? Were we able to get a patient to further his education, graduate from high school? And we have many successes along those kinds of lines. And so there's been a lot of scrutiny. These programs are not cheap. And so I would echo Tracie's call that one thing we all need to do is support these programs, advocate with your legislators the importance of community violence intervention. We're not talking about defund the police here. Let me be very, very, very clear about that. But there needs to be funds directed towards community initiatives like this, because again, this is a problem that we cannot arrest ourselves out of. So I, like Tracie, could go on and on and on and on, but we really would like to hear your thoughts. And so maybe I'll start by throwing it back over to Mr. Tate and ask him to maybe talk a little bit more about his experience growing up in Chicago, and specifically the best known street level violence intervention program, which is Cure Violence. Thanks.
Yeah, absolutely. Thank you, Dr. Jacobs. So you touched on some very, very key points. As I mentioned, I'm a master's and doctor level social worker, licensed master social worker. I had to do over 300 hours of psychotherapy with children, with adults in the hospital. There's some things that we know from research, from medical and psychological and psychiatric science about children exposed to the levels of violence that Dr. Jacobs was talking about, and the increased risks for developing conduct disorders, PTSD, even obesity, later in life heart disease, due to many of the adverse childhood experiences that they experience just by hearing, right? Not even just seeing, just by hearing, and developing secondary trauma by even learning about what may be occurring in and around their neighborhoods. And so there's some direct health correlations with this exposure to violence, but particularly where I grew up and what's still unfortunately happening now, shootings happen so much you have to normalize it, right? And I often mention I'm an Iraq war veteran. If I jumped and was scared every time a bullet went off in Iraq, I would not have been able to be effective in leading my troops to safety, right? And leading my troops out on missions. So the human body will adjust, even if it does some maladaptive adjusting. And as you know, with the veteran population, if you don't adjust back to the norm when you come back, then you develop things called adjustment disorders, post-traumatic stress disorders, and et cetera. Many of these children have been living in these environments for 14, 15, 16, 17, 25 years with not a lot of breaks. I was at ShotSpotter before I came here for 2 years, the gunshot detection company. And the first thing that I asked them to do when I got there is give me all of the gunfire that occurs around schools. And there were cities in this state and many around the country who have more than 1,000 rounds that will go off in any given year just around the school, right? And so in the city where I'm from, 3,000 rounds. Now, if you can imagine what happens to a child's brain, what happens to adults who just have to survive there. If you have a choice of leaving, then you leave. And everybody else who has been stuck there for generations and generations suffer from a slew of adverse health outcomes that's related to that trauma. It's hard for you to go out and walk and be physically active if you're afraid that it's going to be shooting happening. When you live in the food desert, not having access to nutritious food, not drinking enough water, not getting enough sunlight, has some direct adverse health outcomes as well. And so there's this cascading effect that happens. And so CVI workers, specifically being from those communities, practitioners from those communities, clinicians from those communities, or who spend a lot of time working there, will also start to take on some of that stress. But what I love about CVI is the training that the practitioners get, particularly the outreach workers, the professionalization that's happening in that field, allowing them to really be the boots on the ground, who have that lived experience, who have the empathy, who have the connection to the resources to really help the community to stabilize. I will add, outside of CVI workers and police and fire and EMS when someone gets hurt, it is very few people out in the streets in the evening when the violence is most likely to happen. And one thing that I will say is in the Boston Miracle in the 90s, the reason that clergy and police even found each other is because clergy decided to get together and start doing some walks at night, and they kept running into police who were doing some over-aggressive policing, particularly in the Black Roxbury neighborhood when they first started. And so they kind of got into it, and then they will both be at the courthouse. I'm gonna make sure I get Dr. Jacobs a link to, the New Yorker did a really good documentary on kind of how that started. But as Tracie mentioned, and Dr. Jake, it takes everyone. I like to be a little solution focused. So one thing that I would say is in any way from the clergy side that we can reduce the exposure of these young people and families to those environments where we know the gun violence is happening, while we work to prevent and engage with a lot of the young adults who may be engaged, I think would be very helpful. Growing up in Chicago, we did shut-ins at night on weekends and 4th of July and New Year's and others when we knew it was going to be lots of with gun violence. And literally they put us in a basement in the church because all we heard was gun violence, like, and gunfire all around as a norm, right? And so there is a need, there is a space, and I'm gonna be quiet now. We need to remove a lot of the young people who want to be involved in pro-social activities from that environment where the gun violence is happening while we help to stabilize it. And that's not to remove them, who are some of the best and brightest that can be in the community. It is just at the present time while we work to get these things done, if you can have them at your place of worship or at a sporting event or at a movie, a play, anything that they can engage with that is pro-social and helping them heal. And right, I don't want to get too religious on the call, but some prayer, some meditation, some healing, some confession, some pastoral counseling. There's a slew of things that are needed. Actually, all of those are needed. And so whatever way you can partner with Dr. Jacobs, Tracie, and myself to get connected to the CVI workers who are working in the field. Because again, trust in government and institutions is very low in the hood, very, very low, because for generations been neglected, right? And it's been a war zone. And so oftentimes coming in without the credibility or connection is hard, which is one reason, even for me, I'm gonna go spend a whole day in dorm tomorrow just because before I give any advice, I want to spend a couple of days on the ground, understanding and living their reality. So thank you.
I'll jump in. I was taking some notes because I got super excited about this conversation, and a couple of things I just wanted to highlight. Dr. Jacobs talked about the root causes of violence, and I want to go back and just add another piece to that we cannot deny, and that is racism being a root cause of violence. And we'd be remiss if we didn't add on to that. I want to tack on to Gerard talking about generational and historical trauma. Many folks that are living in these communities that are impacted by violence most frequently are living in generational trauma. Their parent, their grandparent, this is what they know. It has become the norm, unfortunately, for them. I grew up in Lexington, North Carolina, so not a super small town, but small. For in comparison to, say, Charlotte. And I remember not the first time I saw a gun, but the first time someone put a gun to my head, I was in the 7th grade. And I was down the street at my community pool. And it was just a norm. And from then on, it became very much so a norm for me. So I'll say a couple of other points is that, we have to, as a community, do a better job of supporting youth and families, and not just supporting youth. Because youth they have to go back home, and they have parents and families and caretakers that are experiencing the same amount of trauma that they have not had anyone to help them deal with. So they can't really help their kids through it. A lot of them don't have the means, as Gerard talked about, or Dr. Jacobs, to move out of the situation that they're in. They live where they live because that is what they can afford. That is what is close to transportation, so they can get wherever they need to go, be at work or school or whatnot. So sometimes those things are not an option for them. These communities have been disinvested in for a very long time. And so when we talk about distrust for institutions and government, that is because we have not done right by people in these communities. We just have not for historically. And it takes a while to build trust and establish trust. If you're not from that community, it's going to take a while for you to go in consistently. Right. And say that I'm not just this person that lives on the other side of town, but I'm truly here to make a difference, to see what your needs are and see how we might fulfill those needs. I'm not being someone that's coming in trying to research a community. That is not what people want or what they need. And you're going to be met with a lot of opposition if that's the way that you come into communities. I'll say that one of the things that we've done, and I'll shameless plug for offices of violence prevention or offices of neighborhood safety, CVI is a wonderful tool, but it is only one tool in the tool belt. One of the reasons we started the Office of Violence Prevention, or that they exist, a lot of times they're called the Offices of Neighborhood Safety or various other things, is that someone has to drive the bus. CVI sits alone as one little entity. And if there's no one helping to figure out how that fits into the larger piece of the pie, then you're just doing one thing in one spot. It's like dropping a piece of chocolate on a white shirt, and you rub it in and you think that that's going to take, and you realize that there's chocolate stains all over the shirt. Well, you've only dealt with one stain. And so thinking about how do you think about community violence intervention programs and this work from a holistic standpoint, and how you take care of the whole family, the whole community, and not just one entity or one individual. And again, it takes everyone to get that done. So one of the things that we have been able to do in Mecklenburg County is we started a community Carolina Violence Prevention Collaborative. We have a lot of acronyms, so that's a CVPC. And so what that is we gathered together a lot of community-based organizations that were already doing work in this space. Again, we identified who was already doing work in this space, tried to gather those folks together and say, what have you been doing? Who are you serving? Looking at where there were gaps in services, and providing those community-based organizations with the resources and tools that they need to be more resilient. So organizational resiliency is one of the things we work on with them, helping them identify opportunities for funding, helping to support them with getting all of the things necessary to actually apply for funding. A lot of those organizations started out of personal tragedy, and that they don't know the business of running a business. So some of the things that clergy can do in faith communities is use the resources that you already have within your houses of faith. You have people that write grants. You have people that do educational programming that can teach. You have people that do advertising that can tell them, show folks how to develop a flyer to get somebody to come to their event. Those are things that community-based organizations need, and you already have those within your own ability. So thinking about what you have and how do you utilize that? How do you partner with other houses of faith that might be on sides of town that are experiencing high rates of violence? If you are on the east side of town and everything happens on the south side of town and no one's coming over there, then all of your efforts are futile if you're doing them on the side of town where there's nothing really happening. So think about, collaboration and partnership with other organizations, thinking about those root causes and who is working in those spaces. One of the great things about our Office of Violence Prevention being housed in public health, when we talked about those root causes, and Dr. Jacobs talked about poverty and food insecurity and housing, some of those things are what the county and public health already does. And so it makes it easy to collaborate in a lot of those different sectors to address the needs of people that are experiencing high rates of violence.
And so I'll just tack on one last thing here, and then we can open it up to Q&A. And this is not a new thought, because I'm just echoing what has already been said. And so I hope that you've heard this evening that collaboration is key. When I first arrived at Charlotte, I think as Tracie will tell you, there's a lot of people working in the violence prevention space. And because of all the social determinants of health, you may not think you're doing violence prevention work, but you actually are. If you're addressing some of those root causes of social or social drivers of health, then you're doing violence prevention. And we know that those same things that we mentioned that drive violence, whether it's food insecurity, housing insecurity, racism, poverty, they drive a whole bunch of social ills. They drive gang involvement, they drive teenage pregnancy, they drive alcoholism, truancy, et cetera, et cetera, et cetera. So you can, I was getting ready to say, you can kill many birds with one stone. That's probably not a good phrase to use with this kind of gathering, but I do think we all need to recognize the roles that these social drivers of health and behaviors really have on multiple behaviors. There's a lot of siloing, and if I had any piece of advice, would be to find out what's happening in your community around violence intervention and join with those folks. Everybody sort of wants to go out and form their own foundation and their own initiative that may be duplicative of what's already going on, or may actually not be what the community thinks is in its best interest. And so the first thing to do is reach out. Having said that, there are things that individuals can do, because as we think about lack of education and lack of access and lack of opportunity, as Tracie just said, there are folks in your congregations that can provide mentoring services. They can provide educational opportunities, shadowing opportunities, things that these kids do otherwise don't have access to. And and those should be thought of as being violence intervention strategies. We don't think of them as being them, but open up your gym on the weekends. Identify a place where kids can go and feel safe and feel heard and feel supported. Tutoring programs, whatever, work with the school system. So there are so many ways that we can become involved in violence prevention if we broaden our definition of what violence prevention looks like. So I'm going to maybe turn it back over to Sunny, or if there are any questions in the chat, I think we'd be happy to answer those.
Thank you. I don't see any questions in the chat, but we will open it up to it shortly. One of our priorities as a diocese is to collaborate and form partnerships. That means that we encourage our missions, parishes, ministries across our diocese to form partnerships and collaborate with other agencies the way that Dr. Jacobs was just describing, so that we don't go out and try and charter something ourselves if it's already existing, but how can we support it? How can we help it and find out what their needs are? And Tracie definitely hit on that. What are the people resources that we have that can augment and support and collaborate with existing programs in our communities around our state and around our diocese? I might add to that to see if there's anything else that you can think of, or the question that would impact us all. Our parishes and different ministries and missions are in very different communities across the state. They represent very, very rural areas, small towns, and then large cities like Charlotte, Mecklenburg. So what are ways that people that are in very different circumstances than maybe Charlotte, Mecklenburg, would they need to go to a sheriff's department, or how would people across the spectrum of our state and the diocese learn ways to be involved if there isn't anything existing, for example? And
Yeah, so I think, yeah, in more rural areas, I think that your community health centers and, of course, some of your sheriff departments may have something happening. I think you have typically a county health department that may also be. So I will say that there is some recent history of collaborations of law enforcement and more health-focused interventions with the opioid crisis, which of course has been affecting rural America just as much as cities. And so there has been some movement in those areas about being more preventative, proactive, some harm reduction things that are happening. And so you can reach out to the State Office of Violence Prevention and let us know where you are. And we'll make sure that we find the best contact for you and put you in contact. So I'll make sure you have that. But there's probably a task force of law enforcement and health, and definitely community health. It's a federally qualified health center around. But the easiest step now that we have the state office is just reach out, email us, and we'll do that legwork for you.
Thanks. That's incredibly helpful, Gerard. You're already being a resource. Okay, let's turn it over to questions and comments. We have we white folks need to promote reparations, close the racial wealth gap. And yes, a component that Tracie has mentioned, in one that our diocese is working on with reparations and addressing, is that very thing, to address some of the problems that underlie this, to not look at finger pointing and that Dr. Jacobs mentioned earlier, but how can we get to the root of the problem? Gregory Jacobs asked, can you give us specific examples, either in NC or elsewhere, programs that are working? Any of the three of y'all want to dive in on that one? I think that Tracie will take the program.
Yeah. Go ahead, Tracie.
So I think that there are, and working is, we're going to put that in quotes, right? Working, what does working mean? If you're asking, are they seeing reductions in violence? Is working? Are you saying that they are changing social norms in areas? Is that working? I think working can mean a lot of different things to a lot of different people, depending on which bean they want to count. So I'll say that there are definitely programs that are working across the state that are effective, and that have shown promise. It takes a long time. So again, when we start talking about work in this space in North Carolina, it hasn't been going on for a very long time. So it's going to take some time before people can actually see change happen. It's slow. One of the things that we always harp on when we think about, our elected officials here in Mecklenburg County, it's been a process with educating them that we don't drop a bean in the ground and tomorrow, woo, there's no violence. That is not how it happens. Most often things get worse before they get better. And that's just the nature of the work. So because we haven't seen a lot of people doing this work for a long time, I don't know that we can name a lot of specific programs across the state that are working well, because they haven't had a chance to see the results of the work that they've been doing. So I think anything that you're doing as you're moving the needle is helpful. There are a lot of people working in a lot of different spaces. One of the reasons for having an Office of Violence Prevention or Neighborhood Safety is that there's some house where there's some accountability. There are many people doing work and there's no one accountable. Who are they telling? they don't even have anyone to tell that reports it back out to people. And so those are things that we have to work on in this space with, making sure that we're reporting out what is happening so that people can say, yes, we are seeing some ground changing efforts. And so it's hard for me to answer that question without knowing specifically what you're looking for. I think, again, it's just going to take some time for us to see. Even, our ATV program that was operating in that one pilot area, it wasn't a whole lot of statistical sound data to pull back and say in the last, year and a half that the program has been working, what they've been doing, but they have been able to tell stories about impact that they've had with individuals and families in that community. And so for someone that lives in the community, that is more important to them than the number of things that have happened. And so we have to tell those stories using not only quantitative data, but qualitative data. We've got to tell the story. And some of that is getting media involved as well to tell the story as we shift the narrative. Media will always report on all the negative things that are happening, but they don't always report on all of the good things that are happening in those same communities, about community-based organizations that are working, CVI programs that are working and changing lives of individuals step by step. And that is really how this works. It is, one individual. We don't drop a bean and just be like, oh, we got everybody in this whole neighborhood. There's no more violence. We have cured it all. If that were the case, we would be done. We wouldn't even be having this conversation. So I think a difficult question to answer, but there is work happening. And I do believe from some colleagues across the state that are doing some things that may not be as well organized because they may not have the resources that a Charlotte Mecklenburg has. We're fortunate that we do have a lot of resources, and there's someone that's driving the bus here. So I'll stop there and see if Gerard or Dr. Jacobs have any more conversation about that piece.
Yeah, I would just say that we live in an evidence-based world. Everybody wants evidence. And we are struggling in the violence prevention arena because of something called the Dickey Amendment. And this gets into the weeds, but let me just explain to you what happened. Many of you are probably familiar with this, but in the late 90s or late 80s, I think early 90s, there was an amendment that was put forth in order to balance the budget, as I recall, that essentially put a freeze on all government-funded violence intervention research. That had a chilling effect, not just on government-funded violence prevention research, but all violence prevention research. And so it was not until 3 or 4 years ago that that ban was lifted. During the Biden administration, during the early part of the Biden administration, that ban was lifted. And so now there is a proliferation of federally funded violence prevention research programs. What that means is we're 25 years behind where we should be in understanding the causes of violence and what works. I think most people would say today that the best studied intervention program that we have is the Cure Violence model. It's the one that came out of Chicago. It's a street level violence interruption program that has been adopted across the world, not just in this country. It's been adopted across the world. So it has been studied. And they know that when that program was very successful initially, and then, like many programs, had trouble sustaining itself because of lack of funding. When the funding went away, the violence came back. And so that's not the only evidence that supports the effectiveness of that program, but that program is in action here in Charlotte, and Tracie can speak to that. It's a limited program. That program has been adopted in Durham with the Bull City United group. I think, Tracie or Gerard, correct me if I'm wrong, I think there are other cities in North Carolina that are adopting that street interruption model. So that's a little bit different than it's a narrow slice of that pie that Tracie was talking about when you're talking about community violence intervention. But most people points to that program as an evidence-based program that seems to be able to interrupt violence, hopefully before it occurs at the community level.
I'm going to jump in real quick, and then Gerard, I saw you about to jump in too. I'll say this about a model. a model is as good as it is implemented with fidelity. And so we use the Cure Violence Global Model. Our ATV program is built around the Cure Violence Global Model. So that is what we utilize here in Mecklenburg County. But I'll say the Cure Violence Global Model, just like any other model, is not going to be effective in every community. You have to assess the community for what it is and what it has and what's going on. And so there are a lot of people that are jumping on this bandwagon to utilize a model that may or may not be most effective in the community in which they want to use the model in. And so I'll say that CVI, again, is great. Models are great, but they, if it's evidence-based model, it is only as good as it is implemented with fidelity. And sometimes it's very difficult to do that when the community doesn't look like the same community that it was implemented and tested in. And so that's where you'll see some of the back and forth with whether or not people say these programs work. We have an area, particularly in Charlotte, that we know for certain that the Cure Violence Global Model is not going to be effective there. It is an intersection of I-85 and Sugar Creek. If anybody is familiar with Mecklenburg County, we have 13 motels that are pay per day motels. It is at a major intersection. We have human trafficking, we have sex trade, we have drugs, we've got mental health, we got a ton of unhoused individuals. You name it, it's a food desert. You name it, we got it. And so it is like throwing the kitchen sink at something and thinking that we can take this model that's designed to work in a particular area. And so the Cure Violence Global Model really does not work in every space. I'll say that. So you have to be very careful about when you're selecting a model, if that's something that you want to do, and wondering whether or not it's going to be impactful.
Absolutely. And I will say there is a severe lack of sustainable funding for the programs that we're talking about. And so oftentimes there are people working on a shoestring budget, or I used to be the Strategy and Innovation Officer for Violence Prevention in DC. Long title to say I advise the city manager and mayor on CVI issues and working with police and them together. Right before this 2018 to 2020, there was no federal money even then. That's only a few years ago, right? The money for CVI from the federal government just started coming in like 2021, maybe, right? Maybe 2021. So as Dr. Jacobs talked about, the research, there's a research gap, right? And so if we had enough research, we could say, oh, the research has been finding X, Y, and Z. We can implement that right now. What's happening is there's a lot of money from the CDC and others to catch up. Basically, we're trying to catch up, right? And like anything, if you think of medicine or mental health or even public administration and engineering, you have to get that research. It has to be tested. We have to take a science approach to it. And then we know it's safe. We know how it may affect different populations, different socioeconomic environments. I will say advocating for sustainable funding, and I'm a social innovation person, right? There may be opportunities for clergy to come together as a coalition and other things to look at some funding that is just for clergy, right? Whether it's at the states, whether that's at the federal government, whether that's through foundations that may be more willing to fund an initiative that you may have, and you collaborate with that community in which you're talking. We're going to have to get collaborative and very creative. I'm trying to make this a key part in the state of public safety and public health, right? I sit at the Department of Public Safety. I work with the Department of Health and Human Services. I'm a mental health clinician, so I'm juggling these things together. If we make it a part of public safety and public health, then both of those funding streams can be used for something that takes a collaborative effort, right? Asking some questions of your local area. If you have 100 vacant law enforcement positions, right? Why are we not looking at some of those positions to do these things? Again, I'm a former cop. I work with them all the time. I'm not saying defund, but they can't fill those positions. If you give funding to the police right now for 100 new positions, 100 new positions will go unfilled next year because many of them have 15 to 30% of their offices vacant right now that are fully funded by local government, right? And so those days are over with. How do we get creative in staffing, right? Some of the, maybe one or two of them may be funded and staffed by you, right? I'm being honest, and they're attached to those local communities. Maybe some of the rural clergy and groups can get together and start their own program in the rural environments, right? Stuff that may work in an urban environment may not work there, right? And I will tell you, we have even less research on CVI models that can work in a rural environment. So if you're willing to try to start something, we will definitely be willing to help and support you, because that may be the model that has to be scaled there. So when we talk about collaborative approach, this is, we really mean it.
Would anyone like to unmute and ask questions of our panelists if you haven't put a question in the chat box? Yeah, Maureen, go ahead.
I'm in the East Greensboro, Guilford County area, and over the last good luck. I also come from the Long Blue Line, and I did my nurses training at Bed-Stuy. So I'm like you, Dr. Jacobs. I've been working on this for a long time, and I'm getting pretty old doing it now. Here's the deal: we have a community dinner that we have folks come in every single Tuesday, and I get a lot of people who are finally starting to open up to us about what the social needs are in that area. It's great. Where I'm stuck right at the moment trying to find help for is that we have a significant number of grandparents, particularly grandmothers, who are raising children. Okay, because that I'm one of the congregational nurses. We're doing the ACE program to test out these families, and oh Lord, the numbers will scare you. But where I'm at right now, and I don't know what to do, is that I have grandparents and aunties who are saying to me, I don't know how to reach these kids because I'm so old. And they're not really old. It's the worlds are different. The world these kids are from. And that's the program that they're asking me. They're asking me and the congregational nurse that's with us, saying to us, I need to know how to reach my children. I need to know how to reach my youth. One is working with her niece through the court system right now, but she's one of many. And I don't know exactly where to look for them, but it is something that I think is it might be being missed in our area, because that number is so significantly high of older folks raising children.
Yeah, it is.
Do you have a so the city of Greensboro has an Office of Community Safety. I'll make sure you get this, but I actually don't think they. Do you have a major university near you?
Several. And I mean that seriously. So the UNCG is there. You know, we have some HBSCs. We're loaded. We're really good with communities, and we're using their interns now to work in our programs. So I just need to know what to get help with.
Yeah, I think you and I should probably talk more and reach out to their School of Social Work. And you may be using the interns now, but I want to tap into some of the professors to learn. There are social workers who work on this specific issue. It's not, mine is on trauma. But I do know that children, youth, and family social workers work on this specific issue, because across our nation, it has been one that has been a problem for a long time. And so I know I can help you find the people who would know, whether they're here in your area or across the country. I'll reach out. Once we talk, I'll reach back out to my old graduate school we will find the answer together. But I know it's not something we need to recreate. It is
and that's what I'm kind of getting at. I mean, the congregational nurses are doing the ACE programming, so we're seeing what it is. And the problem is that middle layer is not there. You know, that piece, we may be able to identify what has gotten the parents themselves into drugs or problems with law, or, you know, repeating violence acts that were done to them, but they're gone, they're missing. And what's left is this this
generational gap. Yeah.
huge generational gap. And Sonny, you know who they are. These women who are coming to our meetings on Tuesday night are not Episcopalians. They're Christian women who come in the door and go, I don't know how to talk to my grandson anymore, you know, and
Right. Yeah.
that is that I can't afford to lose. And I'm sure you already know that a nurse's best friend is a social worker, because
No, we work together. Yeah, we two peas in a pod. For sure.
you know, they can take team nursing in and out of medicine over the years, but the team itself stayed together. So
For sure.
yeah, anything you can do to help.
Yeah. For sure. Please email me. Yes.
Is hot.
And Maureen, I'll add too, I think that this is also an opportunity to make sure that you're using your community-based organizations, right? If they are already trusted and have partnerships and people know who they are, it is much easier to get someone to know that knows you to come in and say, look, honey, you might need to say this versus saying that. I can't go in the community and say that if I don't know you and we don't have that relationship. So a lot of this work, you know, I think about violence prevention work as a whole, it is about relationship building, right? Mm-hmm. Without relationships, this doesn't work, which is why there's the relationship with social workers and nurses, right? There's a relationship. We partner and we do the things and we fill in gaps that other folks can't fill. But we underutilize our community-based organizations. They live in community, they know people, and we do not utilize them in a way that is most beneficial for the people that they are serving and the people that we want to serve as well. So I say tap into some of those community-based organizations, some of these civic organizations where they provide mentorship programs. You know, there are a ton of programs that are designed for adults as well as for kids, or have a component for both. I think about things like, you know, 100 Black Men, think about sororities and fraternities in the community. These are folks that you can certainly tap into. This is what they do. They serve. And that's why they were created, and we underutilize those folks. So I would say tap into some of those folks as well.
We're a tiny little mission church, but we are tapped into UNCG's public health program, master's level and above. And the thing is that we're very fortunate to be able to say that the director of the program is a member of the church. Oh, yay! You know, so we kind of run this poor woman into the ground. One of the things that I have to deal with too, and then anybody that can give me suggestions on, we have to be cautious with our pulling in police and even fire department into our educational settings, because we have a large community out there that either has a mistrust or a misunderstanding, or we have a large Latino population that we have really brought into helping out, you know, really serving that community. And if I told them we were having police speak, they wouldn't come. And so I need some help with some creative thinking on how to get around that too.
Yeah, I think what Tracie mentioned.
Sorry, go ahead, Gerard.
No, I think the community-based organizations, especially with the Latino population, there are some major ones there. And actually, in working with you, it may even help their future grant applications to show that they have those partnerships to grow their capacity to do it better. So that's all it is.
Yeah, and in terms of the law enforcement issue, it's always a double-edged sword. We don't want to shun our law enforcement colleagues, but we understand that there are significant levels of mistrust. And it's just what Tracie was saying earlier, which is that you have to take the time to build those relationships. They come in and they see the uniform, the party's over. And so if there's a way for them to begin to work on building those relationships in a non-professional setting where they can come in and they're not wearing their uniform, badges off, no gun. They're coming in and they're showing concern like everybody else in the room. And then you give them time to be able to establish those kinds of relationships and the genuineness of their intent, then those things will happen. But they will not happen from an lack of authority perspective.
And I'll add one other thing, just thinking about CVI as a whole. We have been successful with working with local law enforcement. The model that we're using, the Cure Violence Global model, does not work with law enforcement. However, that does not mean law enforcement doesn't work with us, right? So one of the reasons for having that Office of Violence Prevention or Neighborhood Safety is that you have this kind of this conduit between the two that don't talk, because the model doesn't allow for that. And it's about building trust in the community. So they don't have those conversations. But local law enforcement here in Mecklenburg County, they support this work because what they realize is that they cannot do it on their own. And they realize that CVI allows for a place that they cannot get into. If the community has distrust for law enforcement, it doesn't matter what they do, there's going to be distrust for law enforcement. And so they allow, our CVI team, our ATV team, to do the work that they need to do on their end as an extension of law enforcement, right? They don't work together, but they still have common goals, and that is to reduce violence and keep communities safe. So I think it's important to make sure that you have that buy-in from law enforcement and that they realize that we're not stepping on their toes by doing this work. We're just trying to assist them in a way that they need help in. So I think that's important to note.
Grace is asking for a point of clarification, Tracie. She keeps missing the name of the model that you're using.
So the model we're using is Cure Violence Global. And the name of our program in Mecklenburg County is called Alternatives to Violence. So typically you utilize the model and every community is going to come up with whatever the name is for their particular program. So that's how we have ATV.
Thanks, Tracie. We've got another question in the box, and we'll maybe need to be our last one as we're looking to wrap up shortly. Have you heard of greening, cleaning, and lighting as 3 ways that can reduce violence by up to 20%? I was just reading a program on this in Philadelphia that was having some success, but panelists, what do you think?
Yeah, so there is someone put my law enforcement hat on, crime prevention through environmental design, called CEPTED, is a well-known evidence-based intervention that's typically led by law enforcement, but it's mostly public works, engineering, code enforcement, et cetera, et cetera. But CEPTED, crime prevention through environmental design. And with that comes a lot of non-law enforcement interventions around cleaning up parks, graffiti, lights, those things. But CEPTED, SPTED, crime prevention through environmental design.
And I'll say that I echo that. That is something that is actually in our strategic plan, because that is something that everyone can do. So we ask, communities to make sure that you report when there's poor lighting in your neighborhood, if there's poor sidewalks, if people tend to act better when they live in a community that looks better. So when it looks nice and you've got nice plants and trees and flowers, people tend to act better. If you take people to a party and you say you have to dress up, then they are more likely to not fight and cause a ruckus. But if you let them wear sneakers and t-shirts, then you're going to get what you're going to get, right? So it is really that is a real thing. And that's something that anyone can do, right? Is look around your neighborhood and say, are there vacant buildings? Is there trash pickup? All of those things make a world of difference about how you perceive your neighborhood and how you want it to remain. So that is a real thing.
Thanks, Tracie. David, do you want to chime in with that one? Oh, he's good to go.
I put a couple of links in the Tracie's program, the first one. And then the second one is some things about crime prevention through environmental design. Because as Tracie said, you can all participate in this tomorrow, right? Next week. So.
Well, thank you all, panelists, for being with us tonight and giving up your time. And I'm going to turn over to Sarah, my partner in crime, to share a link with you for further ways to stay connected with those who are with us tonight. Sarah?
Thank you, Sonny, and thank you for our panelists for sharing your time and your expertise with us tonight. And I also want to say thank you for your life-saving and life-changing work that you're doing to make our communities across North Carolina a safer place for all of us. So the work of community violence intervention, I just want to say a quick word about advocacy. CVI programs can only happen if they're funded in a sustainable way and funded at a level that is substantial enough to address the extent of the epidemic in each community. So these programs, as you've heard, can be effective when they receive the funding they need to do the important work of preventing violence day after day and year after year. So earlier this year, the Gun Violence Prevention Task Force advocated at the General Assembly with lawmakers for CVI program funding in the state budget. This is one source of funding in many states, but unfortunately not in ours. The state budget that just passed did not include this life-saving and urgently needed funding. So we're not giving up, and we will continue to work towards getting this funding passed in next year's state budget. I really hope you will join us, and I will post a link for that in a moment. And in the meantime, this leaves cities and towns across our state to find the money in their city and county budgets. Many municipalities that could learn about these programs are not familiar with them, or there are competing priorities. So advocating for CVI programs is essential and must happen in order to make them a reality in more places that need them around our state. Moreover, I believe that it's part of our call as Christians, and I continue to be inspired by the words of our bishops from a pastoral letter they sent out across the diocese last year. And if I could just quote for a moment from that letter, we cannot allow the volume and frequency of these events to leave us feeling numb and powerless. It is time to step outside our comfort zone. It is time to put our thoughts and prayers into action. It is time to bear witness in the public square that our country's tolerance of inaction to the violence is itself a form of collusion with such violence. This is our call as followers of Jesus. This is what it means to become a disciple, to make a difference. And that's from the bishop's pastoral letter from June of last year. So we can make a difference by raising our voices in support of more programs like these across our state. So I'm going to share a form, a Google form in the chat, and I hope that you'll sign up to participate in this advocacy, either at the state level with the state budget or at the local level. When there's an opportunity for advocacy, we will reach out, and we would love to have you join us in this important work. I will post that link right now.
And thank you so much for all that you and your organization have done. It wouldn't be an Office of Violence Prevention, and I wouldn't have a job if you didn't advocate as much as you did and as you're doing. So thank you.
Thanks, Sarah. Sarah and Christina, we covered the bases. Thank you. And thank you again so much for being with us this evening, especially panelists and everyone who's tuned in. Though we will continue to work to help people collaborate and connect so that we can do this work. That's one of the things that I will take away tonight. It takes a lot of collaboration, connecting, being willing to learn and listen what works and not reinvent the wheel to build relationships. Another resource that just came to mind is one of our canons on diocesan staff, the Reverend Canon Kathy Walker, who is the canon for Black ministries in our diocese. She is a proponent of faith in blue, and that would be a good way to connect with her to find out more about ways that we can better bridge the gap that exists with law enforcement across our state. Again, that's Kathy Walker, canon for Black ministries in the Diocese of North Carolina. She would be glad and excited to reach out and collaborate and connect with you. So thank you all again, and I will close us with a prayer and send us on our way, and hopefully everyone will have a peaceful and restful night. The Lord be with you. Let us pray. Holy One, great Creator, you have called us by your holy prophets and your Son, our Lord Jesus Christ, to be repairers of the breach, the restorer of streets to live in. Keep us steadfast in our perseverance to win against violence, that everyone may know and live in the perfect peace and perfect freedom in which you call us to live. We ask these things for your tender mercy's sake. Amen. Good night, everyone. Peace and blessings be with you. Be the beloved community.
Good night. Thank you, everyone.
Thank you.
Thank you.